Hello, everyone. I really welcome you to this week's edition of our program, focused on African women's health. This is a program that is committed to promotion of African women's health at home and abroad. We share the global message of health for all and continue to emphasize that African women must not be left behind in optimal health. My name is Dr. Olaide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. And if you are not with us last week, we concluded our discussion on oral health, and specifically we focused on oral health as this impact on pregnancy and pregnancy outcomes. This week, the plan is to start our discussion on eating disorders. And we're going to use this week and next week to talk on eating disorder related issues. Straight away, let's go to our topic for today, eating disorders. This is a group of disorders that are associated with lifestyle issues. People of all ages and genders may have eating disorders, although they seem to affect adolescents and young women in general. There are many factors that adversely affect healthy lifestyle behaviors for adolescents and young people. And the most important of these is eating disorders. And we find out that eating disorders can actually be seen in many young people in the adolescent period, pretty much due to their inability to adapt to the group they are in or the fear of being excluded. This situation manifests itself when the feelings and thoughts related to eating behavior and food begin to disturb that particular individual severely. Dieting behavior seems to be a common stimulus that leads to the development of eating disorders. The fact that the person becomes too obsessed with food and his or her weight and appearance negatively, sees his or her weight and appearance negatively, and this affects him or her health, relationship, and daily activities. Eating disorders are not only associated with food and weight. However, physical symptoms that seem to be at the forefront tend to then progress with serious psychiatric problems. In people with eating disorders, pretty much, many psychiatric disorders such as mood disorder, anxiety disorder, substance use disorder, and personality disorder are present as comorbid diagnoses. You may be wondering, what are the causes of eating disorders? The reasons for eating disorders are not particularly known. However, it is believed that biological and psychosocial issues play major roles in the occurrence of eating disorders. The underlying reasons for eating disorders are associated with the issues of low self-esteem, depression, feeling of loss of control, valuelessness, identity confusions, and the problems in intra-family communications. We have mentioned those ones that it can affect earlier on, because you may be wondering who can have eating disorders. We said earlier on, if you have not forgotten, that it affects all people of age, whatever age or gender, or even ethnic or racial background. And we find out that many people, as a result of the global community, global village that the whole world is tending to as a result of migration and human movements, many people of African background may also be experiencing eating disorders. It seems to affect people in the adolescent years, and specifically, according to Academy of Eating Disorders, it was estimated that as many as 10 million women and 1 million men are living with eating disorder in United States of America. And in the past decade, it's even estimated that the number of men living with eating disorders seem to have doubled. Eating disorders are psychiatric disorders with increased morbidity and increased risk of death, apart from other associated health issues. What are some examples of eating disorders? These include anorexia nervosa, bulimia nervosa, binge eating disorder, and another one that is considered as unclassified eating disorders. By next week, we are going to look at each of the first three. We're going to look closely at the issue of anorexia nervosa, bulimia nervosa, and binge eating disorder. And this is where I'm going to stop for today. I really want to thank you again for being there with me today. Until next week when we meet again, in case you are wondering who you are watching or speaking to, or you are watching or listening to, this is Dr. Laide Ogunseji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Please stay tuned, and I look forward to seeing you again next week. And until then, it's bye for now.